Good evening, ladies. Hello. Good evening, good afternoon, and good morning as well, because we are covering 3 time zones tonight. Yay, I can see people in there. Very nice. Just say hi to me. Come on, ladies. Come on. I need more people. Come on. I know for the US citizens, it's early in the morning. And for Sydney siders, it's 9 o'clock, 9 p.m. Probably people would be getting ready to go to bed, or maybe, they can kind of view this session just prior to going to bed. Oh, there you go. Oh, thank you, Aruna, for joining in. Malini, thank you. Sandhya, thank you. I should be able to bring Aruna into the frame, so that's excellent, working out. Excellent. Come on, people. I need more people. Yay! I know it's a bit late for the Sydney siders. Indian time, it's okay. It's an hour later. So it's all good. Maybe they might have kind of missed a little bit of sleep, but that's okay. It's all about wholesome Wednesday sessions, right? So yeah, it's picking up. Thank you, ladies, for joining in. Let's start. Welcome to Wholesome Wednesday session number 48, and today is all about sarees, of course, a little bit, and then we are talking about COVID-19 and a type of get to know about what's happening in India, as well as just a little bit of moral support and just being together and just taking a little bit of tips how to manage and what best can be done. And this is what the health chit chat is for tonight. And before I go ahead with that, let me just tell you guys about today. You can see the blue hat here. Well, today is International Nurses Day. So I got the sticker at work and I saved this sticker. The sticker has been falling off so frequently, it wouldn't stick to my sari. And today I'm a Shvetambari, top to bottom, I'm a Shvetambari. I'm wearing a Banarasi, it's a organza Banaras sari. It dates back to 1988, believe it or not. I got it for my convocation in Mysore. What a little spiel to the sari. I couldn't get any white saris because the convocation, only the rank holders and the top performers get invited to the convocation. If you're from Mysore University, you pretty well know. So I got this invite. Well, I had to look for a white sari, right? Looked everywhere in Mysore in 1988. I couldn't find anywhere. And finally, it was the expensive store. I was very reluctant to ask mom because, at that time it was kind of not affordable. And then mom finally said, no, we'll go. And obviously people in Mysore, you do guys know Badshah stores. And anyway, we popped in there and he had the last piece of the sari. And then I said, oh, thank God it's there. And it was blessedly expensive, but my mom said, look, you're going for the convocation, you have to have one. And anyway, ended up getting the sari. And probably I might have draped maybe 3 or maybe 4 times. And after coming to Australia, I haven't opened it at all. This is the first time I have opened since 1993. It's also a favorite sari for my mother-in-law because my mother-in-law has a background of Brahma Kumari, right? And I had draped for a couple of Brahma Kumari functions in Gottagere in near Banegargata Road, and the sisters used to kind of come and say, oh my God, you have an expensive sari in white. So it was all white, and Banaras sari was all kind of hoo-ha at that time. So it's kind of precious for me, so it carries some tails behind. So this is the spiel behind the sari. And tonight, as I mentioned, like we are kind of like, in three different time zones. One is India, one is Sydney, and one is US. So a bit of touch of US here. And this one, believe it or not, which was in 2019, end of 2019, went to LA. And there was this town called the Shanty Town. I don't know, even people in LA or even US, they wouldn't know where Shanty Town is. We went looking for something, and it is a mini chickpad. Believe it or not, it is exactly chickpad. Starting from this end to that end, you have the toys, you have the dress materials, you have the suits, and then you have jewelry, and then you have flowers. It's kind of like, goes from this end to that end. And so that's where I got. So this is a touch of US here, a touch of obviously my sari, a touch of India, and a touch of Australia. Today I've got a coin purse, a perfect white coin purse. I was thinking, when I'm going to carry this coin purse, well, anyway, this served my purpose today. So this was a gift from one of my friends. So I have got all the three countries' touches here. Anyway, so now coming to tonight's session, as I told you, today is International Nurses Day, and hats off and salute to all the nurses who care for us. They go out of their way and provide their services and everything. So throughout the countries, like, it's International Nurses Day. And it is basically celebrated on behalf of Florence Nightingale, who is known in the modern nursing field. And this is to commemorate her birth anniversary. International Nurses Day is celebrated across all countries, and that's what the significance of International Nurses Day. And it's good that we're talking about health and COVID-19. And during the pandemic, when WHO initially declared that as, what did they declare it as? Initially, it wasn't a pandemic. It was in 2020, March 2020, they declared it as pandemic. And since then and up until now, like, nurses are literally providing the frontline care services, and hats off to them. And I'm not going to take too much of time. I'll just introduce Dr. Aruna Boyina, who is the presenter tonight. She's from US. She's basically from India, but has been settled in US for the last 21 years. And she has got her own private practice. She is a rheumatologist and also an immunologist, and she's got a private practice. And she's got two adorable kids, and she loves gardening, she loves vegetable gardening, and she loves to sari, she's a sari lover basically. She is a sari aficionado, to be more specific. And she is a handloom lover. For, in my instance, I love all saris. I love handloom saris, and I love party wear saris and everything. But there are a certain category of people, who are just into handlooms. So Aruna is one such. And she's going to enlighten us about COVID-19 and the do's and don'ts and what we have to take care of, etc. So I'll bring Aruna into the frame. I'm sure I did see her waiting to be accepted. So let me just try again. Sorry, it's the technology. So thank you. You can hear. Okay, Aruna's was excellent. What about Aruna's? Were you able to hear her? I wasn't able to. Thank you. You can hear. Okay. Yeah. Aruna's was excellent. What about Aruna's? Were you able to hear her? I wasn't able to. Aruna?
Can you hear me now?
Yes. Yes.
Okay. Can everybody hear me?
Technology is in the bar.
Oh dear, I've never done a live session like you can tell.
Thank you so much. Thank you so much for taking time. I know you had to reorganize
Hi everybody.
your clinics and everything. Thank you so much. And that too, within 2 days, you had to organize and everything, highly appreciative of that.
No, this is a very important cause, and I'm glad you're doing it. Hats off to you during this time of, pandemic. You started these sessions last year, and they have been very educative, very commendable. Hats off to you, Hema.
Thank
you
you
wear many
so
hats
much.
and
Need
you wear
support
many
like
hats.
you people.
So,
Thank you.
okay. Well, I was kind of hearing my introduction and how you tried to get me on and explain about your sari. You look beautiful, by the way.
Thank you. You too. I haven't seen your full sari, but I'm sure you would be taking pictures and sending it to me before you change to your clinic attire. I need some sari posts as well.
Yeah, it's the same sari which is on my profile page. It's it's a Vidarbhatasar sari. It has those borders, 3 shuttle borders. You know, I love handlooms.
Yes.
So I got kalamkari art done on it from Srikala. So yeah, it's a little special sari. It smells too. It's a buttery smelling sari.
Yeah. So you can smell the dye. Can you smell the dye?
Oh yeah. These are vegetable dyes, and butter smell and all. They don't go away so easy. So
Correct.
yes. So
nice.
is my pace too fast, or should I speak a little slowly?
No, this is fine. This is fine. Yeah.
Okay. Well, first of all, thanks to everybody who has joined, and my personal hello. I was so hoping that this would work because, we wanted to do this together as a team.
Yes.
And I'm technologically challenged, so I could have never hosted a live session. So I thought that. Well, the numbers in India are astounding.
Correct.
And they are just increasing by the day to an extent that when anybody turns on the TV or listens to news or anything, they are just moving into a panic mode.
Yes.
So I would say it is panic in pandemic mode.
Yeah.
So I thought of a few things that, we could do as a team to raise some awareness,
just awareness and some support. And they also need that moral support, even someone talking to them and saying hello to them. That kind of gives a little push to their morale.
Right. I'm sure you all will have some personal questions. Maybe all of you know someone in the family or, in the extended neighborhood who has been affected by COVID. India's second wave came not really unexpectedly, is what most experts are saying, because of the lax, they say because of the lax constraints or not lack of lockdown or whatever, but there's no point putting a blame on what's done now.
Correct.
Let's see what we can do moving forward.
Yeah.
Okay. So first of all, I thought that I should just make aware of many things that most of you already know about. The first thing is, how does COVID manifest itself? In the second wave, we've especially seen a lot of unusual manifestations. First of all, I would say patients can complain of pink eye. We have had some patients who have been complaining of, conjunctivitis, where the white of the eye becomes red because of increased circulation. Sometimes, it's the very common one that we all know about is, loss of smell and loss of taste. And those have been there before. And unfortunately, those sensations, once you lose your loss of smell or loss of taste, it takes a while to get back, but most people have had a good return of their taste sensation.
Right.
Yeah. Some patients
kind of happens very quickly, is it? Like the loss of smell and the loss of sensation?
That sometimes happens to be one of the presenting complaints of COVID.
Oh, okay.
Yeah, that can sometimes be, that's all. Patients may just have that symptom and nothing else.
Right.
There are some papers in India which are being published which tell that if you have had a loss of smell, it is as good as having a positive RT-PCR. The PCR test that is used to diagnose, they're equating the loss of smell with a positive RT-PCR.
Yeah.
And they tell people...
So now I've got to ask you what RT-PCR is, but talk to Indians, like all the Indians, they all know RT-PCR.
Yeah, it is polymerase chain reaction.
Correct.
It is a test where you can detect the viral RNA, and that is considered the gold standard for the diagnosis of a positive, SARS-CoV-19 infection. So some patients very commonly can have sore throat.
Right.
Cough is a very common manifestation. Shortness of breath is a very common manifestation. Sometimes the only thing that people can find, or they can present with chest pain or a heart attack.
So is it more common for people who are asthmatic, or is it for anyone?
Yeah, there are several risk factors for an infection, and definitely we are seeing everybody getting affected. The virus is exponentially affecting each person. Each person who is infected may easily affect 5 people if they have been in the same area for about 10 to 15 minutes. And that 5 people can affect another five people. So 25, that goes on to 125.
So the exponential growth of,
exponential spread of the infection is commendable in India just because of the population density.
And on top of that, they don't maintain social distancing and all that kind of which is required.
It is not possible to, talking about Indian logistics, many people live very close by, big, huge families. People are on daily wages. So we talk about huge lockdowns, but it is not so practical for many people who live on a day-to-day income. So unfortunately, and I actually wanted to bring a mask and show about, don't wear it just covering your nose. It has to cover both, because this virus is spread by respiratory droplets or secretions. So you have to keep the secretions covered. And more recently, let me go back to the symptoms I was mentioning. I talked about the upper airway symptoms, cough. 30% of patients can just come with abdominal symptoms like nausea, diarrhea. They could have vomiting, abdominal pain. You do an extensive workup and you don't find anything, conclusive. Some patients can have rashes, and that can happen to be a presenting symptom of COVID too. So anytime anybody feels that you have any of these symptoms, the best thing to do is to go into a self-isolation. By self-isolation, we mean go into a separate room where, you're by yourself.
You're not
don't mix utensils with everybody else at home. Try to keep them separate, and monitor your symptoms, monitor how you do. The virus, typically we say if somebody is found to have a positive test, if you suspect that you could have any of these symptoms, go ahead and get tested. The test usually takes about a day to come back, but with the increased volume, they haven't been seeing the tests coming back sometimes in up to 3 to 4 days. So you may have to wait until the test is back. But what I am worried about is the test can be negative, because the RT-PCR may not detect all the variants. There's mutant variants they are talking about COVID. At least the Indian variant is called a triple mutant right now, and that sometimes may not be detected on RT-PCR. So if you suspect that you are infected with the virus, I would suggest continue to stay in isolation and monitor yourself. The next one I would say is,
when you say monitor yourself, how else can you monitor you're basically confined to the space. You don't go out or do anything. After a 14-day period, what would you have to do?
Well, I wanted to describe something called vital signs. Vital signs are what we can monitor in all people who are alive. The first one is temperature. We all know that our baseline body temperature has to be 98.6 degrees Fahrenheit or lesser than that. Okay? So anything more than 100.4 is considered fever. Okay? In patients with corona, if your temperatures are more than 101 or 102 degrees, it is significant. Okay?
Yeah.
So I would say you should have a thermometer just for yourself. Don't share the thermometer, okay? And that thermometer, you keep checking your vitals at least 3 times a day. The next thing is blood pressure, which can be monitored if you have a blood pressure cuff, but it might not be possible for many people. The third one is respirations. Normal number of respirations are anywhere from 10 to 14 respirations per minute. Okay? And those are very easy to monitor. You can put your hand on your chest and take a deep inspiration and a deep expiration. So that full process is one breath. Okay? So typically in a minute, most people are able to do that about 10 to 15 times. Okay. But if you think it is going up to 20 times, 24 times, it could be an indication of, you're working harder to breathe. So there could be a possible process in the lung.
Right.
Okay? Yeah. And the next one I wanted to show is the very popular pulse oximetry. Okay?
Yes.
Yeah. By pulse, I wanted to show you all, we can all measure your pulse. We all have a radial artery right here.
Yeah.
And we people in medical field are trained to palpate it and feel for the pulse. But if you want, you can do it yourself. Put your hand this way, and then with the pulp of the other fingers, just lightly press the other side, and you should be able to feel your pulse.
Yeah.
It should be beating anywhere. It's the reflection of your heartbeat, and it should be anywhere from 60 to 100 per minute.
Per minute, yeah.
So in case it is higher than that, it is an indication that your heart is working harder to pump blood into your body.
Yeah.
Okay. So I did get myself a little pulse oximeter to show you all, and I'm sure you all have seen this. Many people have seen this.
Correct. So I think all Indians up there, they are into that.
Yeah.
Everyone has it. But I don't know how many of them know how to use it properly.
Yeah. The worry is it is an expensive machine, and then if somebody is positive at home, then how do you share it? So we have this food processor's glove, it's just a plastic sheet of glove. So I just cut one of this and, the finger of one of the glove. And I have been telling people, or even a plastic sheet, any sheet, a Ziploc bag or something, then you put it on your finger. That way it does not contaminate these areas.
Yeah.
When you try to check your pulse, because it is not considered good to clean this with alcohol each time.
Right.
Okay?
Yeah.
So when you do this and you turn the machine on, you have to give it some time to settle down. It will show you your pulse, and it will also show you the percentage of oxygen your blood is carrying.
Yeah.
Okay? Normal is anywhere from about 97 to 100. Some people have a number of 95. Let me see where I am. Okay, I think mine says 99. That is the pulse ox, and the top number is my pulse. So that's the number of times my heart is beating. It's probably a little higher now because I'm just not sure if I'm doing this correctly.
No, because technology challenged you, so it's pulsating more.
But the bottom number is significant. The 99 number, like you can see, is a good saturation.
Yeah.
It is something to get alarmed if that number is less than 94.
Oh, okay. 94.
So, yeah.
Well,
so when I
make a note of it.
Yeah, if the number is less than 94, that's when you need to seek medical help. Okay?
Right.
Yeah. You were asking me about the risk factors, right, Hema?
Yeah.
Age is a big risk factor.
Yeah.
Age more than 60, comorbid conditions, asthma, hypertension, heart disease, anybody who has diabetes, partly because some of the medications that are being used to treat this condition are steroids. So, and steroids increase your blood sugar. So patients who already have diabetes can have more complications. So what do you do if you have diabetes? If you have diabetes and, since this pandemic is prevalent so rapidly right now, I would say try to get your blood sugars under the best possible control. Take your medications regularly, consult with your doctor. Most doctors are doing telemedicine visits these days.
Correct.
And, unfortunately, your primary doctor or internist or your general medicine doctor, they may be overwhelmed with the number of COVID cases.
COVID cases coming in,
Yeah, but don't ignore the other problems that you have. The best way for an asthmatic to, not go into a panic mode like this with the COVID virus is to make sure that their asthma is under good control at baseline. That is really, really important. The other thing I wanted to tell you is if you happen to, God forbid it never happens, but if you happen to go into that isolation room, you have to ideally stay there till your fever is gone for at least 3 days.
Right.
Okay. The problem with staying isolated is, people are not used to staying isolated. It is very, very frustrating.
Correct.
Many things can be done using technology to connect with family members. Even if somebody comes to give you food and opens the door, wear your mask when you take the food. I would not just randomly open and expose anybody else to this. Clean your own utensils, stay hydrated. Hydration is extremely, extremely important because if you don't have enough blood in the circulation or enough water intake, then sometimes patients can go into kidney problems and kidney failure. And any of these organs, if they are damaged, they increase your risk of heart attacks or stroke or lung problems like we are seeing with COVID. The ones we worry about.
How many in back home, Aruna, would be able to, be provided with your own room or space, Obviously not. Not everyone would be having that privilege of having their own, space.
Yeah. So, wearing masks becomes extremely important. Don't relax the mask wearing, mode at home if you have a sick person at home. Most people who are watching this have a phone or a laptop. So they do have the luxury of having a separate room that they can treat.
Correct.
But if you don't have, it is practically not possible. And that is the reason the infection is spreading so widely. So maybe keep them in some kind of a corner, maybe have an artificial curtain, like a plastic sheet around them, something which isolates so that their secretions are not directly falling on you in case they cough. Like cough can be a big
and
symptom.
Also, even wearing masks, they don't wear it properly. It's always underneath your nose.
Yeah, some people
they need to be educated.
Yeah, some people wear it here, and some people, are always doing this.
Correct.
Yeah, and if you have someone who you suspect has corona at home, I would say wear two masks. One of them can be a surgical mask, and on that, I would say wear your fabric mask. Many people have fabric masks, made of cloth, but not just one cloth mask. So 2 masks, a surgical mask and a cloth mask. That would be a better way of, covering this. You will get enough oxygen even if you're wearing a mask. Believe me, we live in masks all the time. You will get enough oxygen. So don't worry, you won't suffocate. Nothing is going to happen if you're wearing a mask. Okay? Yeah. The other thing I wanted to stress about is sleep. Sleep is really, really important. Yeah. Because sleep is what helps your immune system heal. So if you don't get enough sleep, then you won't heal. And if you don't heal, you can't fight these infections.
Correct.
Okay. There are many medications, many protocols that are floating, on the social media these days as to what you should do. But I would say I would say, consult with some provider before you decide to give someone steroids at home.
Yeah.
Okay.
Yeah.
Yeah. Don't just blindly go and get a chest CT scan, because a CT scan it's not that it comes without any side effects. One CAT scan or CT scan for the lungs exposes to radiation equal to about 300 X-rays. 300 X-rays,
Okay.
imagine. And that can put you at a risk for cancer later on.
Yeah.
So,
and people kind of have come to an extent that they self-diagnose themselves, saying, oh,
right.
if someone had that, it might be affecting me, and this is what I have to do. It's like that comparison, as well as that's not appropriate.
Yeah. That is not appropriate. But if people have any suspicion that you may have something, I would say, even before you go to diagnose yourself, isolate yourself. That is the most important message I want to convey. You know, many people say, "Mujhe kuch nahi hoga." I'm strong. I'm young. How will I get affected? But we are seeing with this wave, young people with no prior problems, fall down like flies, and that is the most devastating part, because they have young children, young families, older parents. So parents are doing a good job trying to isolate themselves, but it is the younger population who hasn't been able to get the vaccine yet. They are the ones who are succumbing to this.
Correct. Okay. So ladies, you take a note of that.
Yeah, the other thing I wanted to bring to your attention is, like I told you, we will concentrate on the 5 S's.
Correct, yeah.
The first one is symptoms. What symptoms do patients who possibly have the viral infection manifest with? The second one is adequate, self-isolation. If you suspect any symptoms, go into self-isolation. Then the third is monitoring of your symptoms and signs if you're in an isolation room. The next one is sleep. And the last one is when to seek medical help. So by when to seek medical help, if you don't have a pulse oximeter, I would say counting your respirations. And if your respiration rate is more than 20, it would be a good thing when you're, when you're, panting for breath. That means you have a little problem with your lungs. It could be COVID pneumonia. So at that time is when we want you to go for the CT. Don't go for the CT when you have a cold or, cold symptoms, or when you have pink eye. At that time, it is not indicated, because, it is not safe to go out to the hospitals now. You would expose yourself unnecessarily, even if you have mild symptoms. 80% of the patients who develop the positive COVID symptoms, it resolves by itself. So 80% of patients will be perfectly fine, and after about 10 days, all their symptoms will go away. Okay? So about 20% out of the 20%, 15% do resolve at home only if you can make contact with, a telehealth provider who can probably prescribe some medication.
Right. By the telephone or video. Or
by the telephone. Many medications are okay to take. The very popular Dolo 650 is okay to take. It is Tylenol, So Tylenol helps control the fever, and if the fever comes down, the heart rate comes down from, from the higher numbers to a more regular number of 70 to 100, and that helps your body heal. Do eat fresh vegetables, eat fresh fruits. Don't eat too much salt. Don't eat foods which have too much sugar. No sodas, no juices. All those are not considered healthy. If you
said no juices. That is a good idea, because people are under the impression, the more you have fruit juices, the more it helps. So that's not the case, right?
As long as it is made with fresh fruit, Hema, it is probably completely okay. But I would say if you're adding artificial sugars into it, that would probably be something worth.
So would citrus fruits be okay?
Fruit should be okay. If you're diabetic.
Citrus?
Oh, completely. There is data for vitamin C. There is data for zinc. So citrus fruits are rich in vitamin C, so oranges, clementines, berries, everything, any kind of fruit, everything in moderation, no alcohol, if you're in isolation. I don't want people to just keep smoking. Smoking, again, that is again an independent risk factor for, people who have to develop more severe COVID. Yeah, obesity is one more. If you're on the more obese side, then that is another risk factor. The other monitoring I wanted to tell you about, if you happen to be in isolation, is called a 6-minute walk test.
Right.
It's a test where you may be reading about it, seeing it on different protocols. It's a test where you check your baseline pulse oximeter.
Yes.
And then you walk on a flat surface for about 6 minutes. Put a timer on your phone and walk for 6 minutes. And after 6 minutes, then check your pulse and then check your blood pressure and your pulse oximeter again. If there is a 4% drop, so if it is 95 and it is coming down to 91, or if it is 96 and coming down to 92, that is significant. At that time, you need to ask your doctor if they would order a CT scan of your chest or a chest X-ray.
Oh, okay. That's a good indication. Like a simple one, anyone can do.
Anyone can do, and it is since most people have their personal pulse oximeters. It's a 6-minute walk test. That's what it is called. It is also called SMWT, 6-minute walk test. It's very commonly used to monitor your lung in pulmonary clinics, right. But it is a cheap CT is what I call it. You can easily do it without having to risk yourself the exposure of going through all that radiation.
Correct.
If you have a 4% drop in the pulse ox, if your temperatures are not coming down, if you have persistent fever after the 6th day, those are reasons to seek help.
Okay. Yeah.
So in the rule of number, the SS, we can add a 5th one. We can add a 6th one, and that is 6th day. 6th day is the crucial day.
Right.
So fevers going towards the 2nd week of the infection is always concerning.
Right.
Yeah, because this virus has a replication phase where it multiplies itself, and at that time you can get fevers. And then it has an inflammatory phase where it causes inflammation. And that is where people hear of something called cytokine storm. You heard of that, Hema? That is where the body tries to protect itself from the virus attack. And that is where many people use steroids. But again, like we were talking, if you are not monitoring what you're doing, or if the dose of steroids ends up being more than what you can handle, now there is this new risk of mucormycosis, or the black fungus.
Another one, the black fungus. Yeah.
Mm-hmm. Yeah. So apparently,
is that a new thing, or it's just kind of like emerged in the recent months?
Right. It's mostly emerged in the recent months. It is a known complication of long-term steroid use, where you can have infection in the sinuses. Sometimes it can go into the brain. So that is, and the only treatment is cleaning up the area. So we are talking about cleaning up these areas, which is not practical.
Right.
But it doesn't happen as much if we are doing management as an outpatient. It is mostly seen in patients who've been in the ICU for a long time, who've received a lot of steroids for a long time. So those are the patients, diabetic patients, like I told you, blood sugars go up with steroids. Diabetic patients, those are the patients who they have been seeing more mucor infections in.
Oh, okay. But I heard that it is more from the rural side, like, the rural area side, the mucormycosis. So is that kind of like, that is what you put it forth, or it could be from anywhere?
It could be from anywhere. Unfortunately, they're seeing it mostly in hospitalized patients because they use the same tubes. If there is some kind of fungus going in through the oxygen tubes, or not having enough time, the hospitals are overwhelmed. patients
Yes.
patients are very sick and they're having to use high doses of steroids every day.
Steroids.
Yeah.
Um,
And, the fungus thrives when the blood sugars are high, the fungus thrives. It loves high blood sugars. So when you do steroids, the blood sugars go up.
wow.
And
That
that's
gives room for the the virus to multiply.
perfect environment for the virus. And that's what's happening. And that's what they have been seeing, Hema.
Oh dear. Okay. Okay. See, it's become so difficult, even to seek medical help in some areas back home.
Right.
So that's another major problem, isn't it?
Right. In many areas, it has become very difficult, but there is, all of us physicians, many of us who live abroad have this organization. It's called American Associations of Physicians of Indian Origin, or AAPI, AAPI.
Yeah.
So we have been offering a telehealth platform for patients to register and, try to talk to us.
Oh, that's nice. Oh,
Yeah.
that would be very nice. If you can just share that link after you finish. That would be
Sure.
great. People can
And
benefit out of that. Yeah.
definitely, this is a completely free service.
Right.
We can't prescribe medications like steroids or remdesivir,
Yeah. Yeah.
but what we can do is guide you through, as to when to seek help, when to
Yeah.
go and
At least,
get
even if they can get to speak to someone, that is what is
Mhm.
important, and that's the basic thing which is not available there at the moment.
Right now.
So
Yeah.
that's what it is. Okay, that
Right.
would be
Right.
helpful. Yeah.
The other thing I would say is I know vaccine is an extremely short supply now,
I know.
but many people have questions on the vaccine. They don't
Correct.
want the vaccine. Many people tell me I don't want to be the guinea pig taking the vaccine, but no, you're not a guinea pig. Many healthcare providers, many people in America and even in India, all our parents, whoever has been able to get the vaccine, it won't completely prevent you from getting the infection, but even if you get an infection, it is going to be very mild and you will probably not die from it. So, it is extremely important to put that in perspective.
Yeah.
So I would please urge, if you can, when you get adequate vaccine in India, if you have a chance
To
get it.
do take it. Yeah.
Because that is how many countries have been able to control the pandemic. And I think that is the goal for India too.
Yeah. Yeah. Anything else you want to share, Aruna? That's good. You have touched base on so many things. I'm sure it would be very helpful.
Well, I just want people to remember, I know it feels overwhelming when you turn on anything, when you pick up the phone, people are scared. Whose phone call is it, or what news should I have to hear?
Especially people who are overseas. It's very kind of just any phone call, you kind of think, oh my God, what's happened now?
Yeah, phone call from India can be really anxiety provoking.
Yeah.
And this pandemic is causing a lot of anxiety in many people. You stay in isolation. After 14 days, people come out, they are depressed. They are so sad because this was something. People are having to cancel all their trips. Some people, can't work. They don't have money. So it can be very anxiety provoking, but just take one day at a time, eat healthy. If possible, do some yoga. I know Hema has shown us some very valuable sessions in the past.
Yes.
About pranayam, they say, and anything, meditation, anything that you can do. Try to think positive. If you have someone at home who is sick, give them a lot of support, a lot of cook fresh food for them. Make it easier for them. Tell them that people do recover. We only see the horror stories, when you turn on the TV or you hear from other people. But like I'm telling you, in 80% of patients, this is a mild infection. It will go away, but it is much more capable of causing damage.
Yeah.
So you have to be careful.
Yeah. And also the
don't,
scenario there, Aruna, is so difficult. If the whole family is suffering, I've heard quite a few stories, through friends.
right.
The whole family is affected. How would you monitor that? It's so difficult.
It is it is difficult.
Right.
I would say try to see if there is somebody in who is your family doctor. Try to see somebody in who you can establish care of. Talk to other people. Pick up the phone. Talk to a friend who's gone through it. Ask them if they know somebody who they have seen when they were sick. That's what my like I told you, my brother-in-law in India also had this sensation of loss of smell and loss of taste.
Yeah.
So he made connection with a doctor who had treated his friend who had COVID in the first round.
Yeah.
So I think it will really help if you make these connections. Make sure you have some paracetamol at home.
Yeah.
If someone has symptoms, try to get some paracetamol. Keep that ready. Many other medications are not really helpful. They're talking about ivermectin and famciclovir. There's lots of medications. There's lots of medical data. Don't try to practice medicine yourself. Try to get someone to prescribe these medicines for you. You can get into trouble if you end up taking all these medications by seeing all these protocols, and then you will not have enough guidance on how to go about and how to manage the patient.
Yeah.
If there are multiple people at home who are sick at the same time, definitely it would be helpful if you have a house with 2 rooms, definitely have the sick people in one room.
Yeah.
In those rooms, it's a no-brainer that everybody has to wear a mask, because that is the first level of
protection. Yeah. Yeah.
Right. Some of them will get a little more sicker than others, depending on what the comorbid conditions they have.
Yeah.
Yeah. But like I'm saying, if there are 6 people at home, one person might get really sick and the other 5 should recover. So we have to be really watchful of these signs.
Yeah.
Like I was saying, when to seek help, when to ask, when to call the doctor, and when to tell them. Many doctors give steroids that you can use at home these days too. So that's why I'm saying it's important to have contact with a telehealth provider who can probably guide you on, is it time to get steroids? Like if the pulse ox numbers are coming down less than 4%.
Yeah. Mm-hmm.
If your breathing is increasing, if your fever is increasing after 6 days, all of those are signs of needing more help. So seek medical help when you need it. But if one person at home is infected, unfortunately, everybody in the family will be affected for 2 weeks. And keep your family separate from others. I don't want anybody to just go out and bring some supplies if one person is infected. Maybe have a friend drop it off. So all those things, because we have to curtail the progression of the virus. If the virus progression is curtailed, then only we can control this pandemic.
Yeah. Yeah. Good. Anything else?
And the other thing, like I was saying, is don't ignore your regular health. Many people have high blood pressure. Many people have diabetes. Many people have asthma.
So
all of
with the medication.
Continue your medications, regularly. The medical facilities, the pharmacies are overwhelmed as well. So if you can order 2 weeks supplies at once, keep them so you don't have to keep going outside. Yeah. Don't have gatherings for the next month or so, till this pandemic numbers start coming down.
Yeah.
Many people were having weddings and they were having parties, and all of that can wait.
Yeah, correct.
Okay. And don't be under the impression that it won't happen to me. I am strong. It won't come to me.
It can happen to anyone.
It can happen to anybody. So just be extremely watchful.
Yeah.
Okay.
Yeah. Excellent. Thank you very much. Do you have anything else to wind off, Aruna?
Well, I just want you all to be very careful. And, we wanted to do this session for a long time on other topics because like Hema said, I'm a rheumatologist. So I deal a lot with bone health and rheumatoid arthritis and other conditions. But this one definitely, I also have an immunology background because I am an allergist as well.
Yeah.
So I thought we can kind of put things together.
Definitely. I will hassle you for those ones in the coming months, definitely, since you have done this. We can certainly have one session. Hopefully by that time, COVID will settle down a little bit. It's not going to go away. That's for sure. It will take some time.
That's for sure. It will take
some time.
And when you get a chance to get a vaccine, then go get the vaccine.
Correct.
Yeah. Yeah.
Excellent. Ladies, if you have any questions, pop that in the message box. Anything medical, Aruna would be happy to answer to those questions. It will be a bit late because, as you all know, she's a busy doctor. She will get to it if there is anything medical. If not, I'm happy to answer those ones, the non-medical ones. I can certainly answer those ones. And if you want any kind of information, as Aruna suggested, that there is a helpline available, and it is international. You can just dial via WhatsApp or even via internet. So you can get in touch with them in case if you can't find any kind of medical help available in India. I know India, it's very crucial at the moment. So any kind of help which is available for you guys, I would ask or urge you all to take advantage of that and approach the website. If you have any questions or anything, they would be able to answer you all. And anything else, Aruna?
Well, I just, everyone will get through this. I just want you all to be positive. Other countries have got through this. I'm sure India will pull through,
Correct. It's just a matter of time, looking at the population and everything, it's just a matter of time. It will come up, but staying positive.
Stay positive. Stay positive is the message. And if you find anybody who is sick, then give them a lot of moral support and emotional support, because these people definitely feel isolated. Is what people are in fear that what will happen if I end up going to the hospital. So keep their spirits high. Try to take care of them as much as possible. And even though you might be scared, it will pass. And that's what I'm sure Hema will vouch to it. We live in different parts of the world, but it will pass.
Correct. Yeah, it will. Thank you so much. And your talk is very much informative and very helpful. And I'm sure the ladies can do a watch party and listen to that again. And probably there would be a few who would love to watch that again. Ladies, please feel free to make a watch party and play that through the Saree Gallery website. And that will be up and running very shortly on YouTube. So you can go and check on YouTube as well. And as I told you, if you have got any medical questions, pop that message there. Otherwise, if you just need some moral support, just buzz me via Messenger. I would be very happy to get in touch with you all. There were quite a few who just wanted to chat with me. And, I enjoy talking to people. So it's just the moral support. I'm happy to provide that support as well. So it would be very nice, just one-on-one, just talk to them, just a little bit of moral support, boost your, just your morale, obviously they would be facing so many difficulties. It's just someone to talk to would make a lot of difference.
Check on your friends is what I would say. Check on your friends.
Correct.
Particularly if if somebody is struggling, then yes, definitely check on them, because they won't ask you for help. And sometimes when you check on them, then you would be surprised to know how much difference it makes. So
correct. Yeah. All right. Thank you very much. And don't forget to post your saree picture, because I want that for tonight. You will be featured on our page, which I forgot to tell you.
Just now I have some light outside. It was dark in the morning, so just now I have some light outside.
Obviously, it would be a beautiful morning up there.
Yeah, it is. This time of the year is beautiful up here, but it is a little chilly. So, yeah. Very good. Thank you for doing this.
Thank you so much.
I hope it was helpful. Okay.
It is definitely.
Okay.
Thank you so much.
Thank you all. Thank you.
Thank you, ladies.
Yeah. Bye.
Okay. Bye. I'll just continue on. I just wanted to touch base a few more things for them. I can close this. Yeah, done. Okay, thanks, Aruna. I just wanted to kind of like, let the members know a few things. Thank you for adding your friends into the Saree Gallery. My motto is to reach 10,000. So I would urge all the newcomers plus the existing ones to add all your friends into the Saree Gallery page. And number two was we were talking about the watch party. Please go back to the events page and play the watch party as many times as you want. And I would urge you all to play the current one, which was covering, basically how to take care of yourselves, the do's and don'ts, which is very much required in the current environment. Just go back and listen to those watch parties again. That would be great. And any suggestions for live sessions, please message me. I have already received a few suggestions, and thank you very much for people know who they are. And I will be in touch with whoever is able to do, and I'll bring across to the platform whatever I can in a different variety of kind of like, keeping occupied. It could be health, it could be entertainment, it could be fun, it could be anything, right? So it's just a wholesome Wednesday. So touch basing on all the wholesome Wednesday topics, we would be able to cover all of those. And I had the other one was, I just kind of like, I just jotted a few points. Like every time I kind of like, keep thinking, no, I have to make sure that I have to tell these. And yes, there have been quite a few members who have started posting their sari promotion posts, which I would not encourage at any point of time. And those posts have been deleted. And there are quite a few who are on my page. They are all kind of like, into marketing and promotion materials. I absolutely have got no issues with that. But as long as you don't post anything on the page promoting the sale of the saris, I really would delete those ones. So just please make sure that nothing is broadcast through my page. And one more thing I wanted was, I think I have covered all of those. Yeah, once again, emphasizing to pass on the topics of interest for the Wholesome Wednesday session. I've got a wide variety. I have covered so far up until May is fully covered, June is fully covered, and I've just started from mid-July, I think. So I've got some exciting ones coming up. Stay tuned, and you would be benefiting from all those sessions, and it is fun and informative and something to take home every week. And it's a nice thing to share and empower you ladies, and just a little bit of community spirit up here. So stay tuned to all those sessions, and I will be in touch with you this Sunday for what's coming up next Wednesday. It is exciting as well, though it may kind of like, sound very simple, but it is exciting. And we will be hitting week 52 very soon. So I started this last year due to COVID, and COVID has continued and it has not stopped at all. So we hope that time comes very soon and we can put an end to COVID, but not to the Facebook live sessions for the Wholesome Wednesdays. So we'll try and do as much as we can. I'm in spirit as well. So I would definitely take you all on a journey. All right. And I will be signing off soon. And you can certainly go back and play the video again. Thank you very much, ladies. Thank you, Aruna, for doing this for me. Different parts of the globe, we still were united, and we ended up seeing everything and listening as well. So this is what the digital technology does to us. And